A ChiroSecure research update. A study published in the Journal of Manipulative and Physiological Therapeutics documented the potential role of maintenance chiropractic spinal manipulation to reduce overall pain and disability levels associated with chronic low back conditions after an initial phase of intensive chiropractic treatments. 30 patients with chronic nonspecific low back pain were separated into two groups. The first group received 12 treatments in an intensive 1-month period but received no treatment in a subsequent 9-month period. A 4-week period preceding the initial phase of treatment was used as a control period to examine the sole effect of time on pain and disability levels. The second group received 12 treatments in an intensive 1-month period and also received maintenance spinal manipulation every 3 weeks for a 9-month follow-up period. The 1-month control period did not modify the pain and disability levels. For both groups, the pain and disability levels decreased after the intensive phase of treatments. For the disability scores, only the group that was given spinal manipulations the follow-up period maintained their post-intensive treatment scores. The disability scores of the other group went back to their pre-treatment levels. This experiment suggests that maintenance spinal manipulations after intensive manipulative care may be beneficial to patients to maintain subjective, post-intensive treatment disability levels. Future studies are needed to confirm the finding in a larger group of patients with chronic low back pain.